One of the things we're worried about is that we get exposed to this virus. So could you tell us a little bit about how do people get exposed to viruses? How do we expose each other, and how do we kind of spread them around? Dr. Kraschauer, do you mind starting on that?
Sure. So different viruses have different mechanisms of spread. For this coronavirus, it's spread, or it's believed to be spread mostly through the respiratory route. So someone coughs or sneezes, a large number of large droplets are spread in the air in close proximity to where you're coughing or sneezing. And then someone else will inhale those particles, or those particles will contaminate a surface. Someone else will touch that surface and then rub their nose or their mouth and inoculate themselves. So there's some controversy about whether this virus is also spread through aerosols, which are very small particles that stay in the air for a longer period of time. It's suspected that that doesn't play a large role in transmission, but in certain settings, like healthcare settings, where people do procedures which can aerosolize particles, for example, when you're giving someone a nebulizer treatment or something like that, then it's more likely to spread in that sort of setting. But for the most part, we're talking about the large droplets. For example, when we've seen that graphic of someone sneezing and there's a black background and you see all those large droplets, and that's kind of what we're talking about for COVID-19.
Excellent. So when those droplets get sneezed out, so how do they actually get, obviously they go on to the next person, but then how do they infect that next person? How does that happen?
So the virus is present in those large droplets, and those droplets need to be exposed to the virus needs to gain entry into your mucous membranes. So as Dr. C said, through the eyes or the nose or the mouth. And so basically, you're inhaling those particles, or you're touching something and then you're rubbing your face, you're rubbing your nose, and the virus gains entry. And it's not until the virus gains entry into your cells that it starts to replicate.
One of the things we like to do is, if we know who's the most susceptible, who has the worst response to that if we protect them, we try to protect everybody. So who are some of the groups that might be the most susceptible to this?
So in terms of getting the disease, basically anybody breathing is going to be potentially exposed to this disease. So it doesn't matter whether you're young or old, anybody can get this particular disease. The thing that we're concerned about is the way different people react to it. As you get older, your immune system gets a little bit weaker. So that's why we see people in the older age groups more likely to have a serious disease, more likely to need hospitalization, and also more likely to die, unfortunately. And the same is true for underlying health conditions. So if you have certain conditions that make your immune system a bit weaker, if you have uncontrolled diabetes, things like that, that can really lead to immune problems, and that's going to put you at higher risk. And if you have lung damage from COPD, you're a smoker, things like that, those types of things cause physical damage to the body, which may make it a little easier for the virus to get in, but it's a lot tougher for your body to deal with that. If it's harder for you to breathe on a normal basis, once you get infected, it's going to cause more serious problems.
We all know we've been told to do a lot of things, right? You're supposed to wash your hands, you're supposed to clean surfaces, but I want to look at and see when we're doing that we're doing it correctly. So can we start with washing of hands, right? We all know we're supposed to wash our hands, but we need to know how to do it correctly. So what are we doing wrong when we're washing our hands incorrectly?
So the challenges with hand washing are either not doing it long enough or not being thorough in the process. When you're washing your hands, it needs to happen for 20 seconds, because the whole goal of washing your hands is to remove whatever viruses are on your hands and flush them down the drain. So you're physically removing them. And as part of that, you want to make sure you're covering every nook and cranny of your hands. You're not just rubbing a few parts of the hands and missing others, because that's not going to remove the virus. So you have to do it long enough. Obviously, you have to use soap and water, and you want to be very thorough to make sure you're removing as much virus as possible from your hands.
What are some of the most credible sources about where people should go to make sure the information they're reading and they're getting is good, quality, accurate, scientifically based information? Dr. C?
CDC website is the most credible of all in terms of prevention, but for research, in terms of new medications or current vaccine development, you can go to NIH website, so cdc.gov or nih.gov. Those are very important federal resources. But academia is also a good source. So Johns Hopkins or coronavirus.jhu.edu is also a very good source of information.
as we continue to practice self-isolation, make sure to subscribe for more encouraging and uplifting videos like this one.